Welcome, everybody. This is Catherine Maloney, one of your co-chairs. Glad you could make it today. Everybody in the room has their agenda and the prior agenda and meeting notes, the minutes from the last meeting on the 26th of June. Glad you all are here. First order of business will be to review those notes and have a motion to approve them or ask any questions. So I'll give you a moment to do that.
Okay. Let me share last month's minutes. Okay. All right, they're in the room and on the screen.
So you want to scroll through those real quick?
Okay. Well. Fantastic minutes.
Thank you. Very thorough.
Mm-hmm.
Don't want to leave anything out since I told her I was gonna do it.
All right. Shelley.
All right. Can I have a motion?
I'll motion to approve.
Okay.
Do I have a second?
Second.
I'll second.
Thanks, Janet. So is motion and seconded. All in favor? Aye.
Aye.
All opposed? Motion passes. So next order of business is presentation about the results of the June 20th CACTA strategic planning meeting that we held.
And you want to do introduction before that?
Oh, yeah, we can. Everybody, I think everybody kind of knows each other, but I already introduced myself, Catherine Maloney, Tri-County Community Action Agency and co-chair. Go ahead.
I'm Elena Martin, also at Tri-County Community Action Agency, also co-chair.
First row.
Jenna Dahl, Southside Behavioral Health. Sarah Moore, Southside Behavioral Health. Jameson Dahl, Southside Behavioral Health.
My team, Kenan Tyner-Smith, Prevention Director, Southside Behavioral Health.
And then let's go. How about Janet? You're off mute. Go ahead.
Janet Newman, I'm just all around whatever you want me to do.
Love it. Brenna.
Good morning, Brenna Link, Population Health Manager for Virginia Department of Health, Southside Health District.
Great. Shelley Clary.
Good morning, Shelley Clary, Education Specialist at the Virginia Poison Center at VCU Health.
Allison.
Hey everybody, Allison Byrne. I'm the Community Engagement and Partnerships Coordinator at the Central Virginia VA Hospital.
And Brian.
Good morning, Brian Price, Virginia Rural Health Association.
Is that it up there, Kenan?
Yeah, you're right. Everybody knew each other. My bad.
That's okay. That's hey.
Well, they didn't know them.
Yeah,
That's right.
Yes, we got a
Our-
couple
our-
new team
Our
players
PC
over here.
associates, woohoo! Yes. They have been conducting all the tobacco problem gambling retailer visits for us. They rock.
Nice.
You guys look, Val's got a picture of y'all right there. All right.
All right, you're on, Jenna.
You don't have to do any updates, so I don't think so. Yeah, I would do that. All right, that sounds good to me. Alrighty, you should be able to share everything to the bottom of the screen. You see my email. And I got the Excel at the bottom. You know, there's the Excel and then there's the, so
There's stuff up there too.
yeah, okay.
I can never see it. Yeah, I'm trying to.
I know, you can hide that, but I don't know how to bring it back if you hide.
There we go.
Okay, so I created a logic model kind of in the format
from what we discussed on June 20th, which is kind of what I went over last time, just about, we kind of decided, youth vaping was gonna be our focus. And then I put it in a way that I could show you guys what we need and what we're missing. Oh, why is it doing that? Okay, well, it looks crazy right now, but it's not what it looks like on my computer. But regardless, our problem statement would be youth vaping. We've got a couple of data points, but we still need some more that I'm hoping that I'll be able to get from the school system. Our root causes are low perception of risk at the moment, which we need some more data points for those. Availability, which I think I'm good on those. And then favorable parental attitudes. For perception of risk, we've got kids that are vaping in the bathrooms at school, which we need data for, and then students selling to youth. For availability, I should just close out of this because this thing's crazy, but for availability, we've got youth are being sold vapes at the retailers, which we have violation rates, and then some information from the youth, our young adult survey. We also have, this is not 100% set in stone, I need to double check with Dorothy, but there's also a lot of marketing towards youth and retailers, which we know we'd probably be targeting when we go to address the retailers anyway, so I wanted to make sure we had the data to show that as well. But that's just our data from our counter tools, which is what Sarah and Jameson are doing currently, so they're doing environmental scans at the retailers, which are telling us which ones have youth appeal, which ones have vapes, which ones, let them in, all that kind of stuff. So that's where we get that information from. And then for the parental attitudes, it's when I was talking to the Halifax youth, they also had said that the parents are giving to youth, which I know we discussed a little bit too. So I wanted to make sure we put that in there as well. And then we can decide which one we want to focus on once I get these data points to prove that they are happening in our area, but also a way to collect data when we actually try to do our 7 strategies to make sure we're targeting the right thing.
Can I ask a question
Yes.
about the low perception of risk?
Yes.
Would the perception that it's better than smoking be included in that, or would that be another root cause?
It's included in that.
Okay,
Depending on who, usually low perception of risk is what the youth think. Kind of, in terms of us talking about youth vaping, so that they think that it's not a problem to vape, so yes, there, but also that can be assigned to for favorable parental attitudes, because them giving it to the youth because they think it's safer can also go under that, so it can be a double
okay.
in terms of attitudes, but yeah,
Gotcha.
that information I do want to get kind of I want to see what the youth and what adults think about that to use in both of those places.
Right, because I think part of it is
Hi,
changing
Dennis.
changing that perception.
Yeah.
Because I mean, when vaping first came out, that was the perception of a lot, or that's how it was marketed.
Right.
So marketing fallacies,
Mhm.
causes were, I would say that initial marketing fallacy, or whatever you wanna call it, that the vape people,
Yeah.
capitalism at its finest.
Right. Right.
You know, so I don't know if that is a, cause you have to now dissuade people. It's a different, in my mind, it's a different root cause. They've been led to believe it's safer. So now we have to change the perception that it's safer.
Right.
Because it's actually, I think the research is coming out, it's
Works.
worse.
Yeah. Right.
Right.
Yeah, they've been misled. Right.
Right.
And that kind of information can go more youth oriented, or it can go to more adult
I
oriented,
think it's
depending
both.
on, yeah,
I mean,
right. Depending on which one we want to put it And on. I'm gonna not to interject, not change the subject, but this article is gonna be in the next coalition. Usually this research that just got put out by the New York Times about how vaping is more harmful.
But the issue comes down to is what Catherine started about, is initially, they even said the science says, and this is the problem. People can use, I use the word sadistics / statistics to say anything they want to say. And folks are getting more and more at we're using this. Have you noticed now the number of, and yes, we're talking about vaping, but we go on the same line, all of the fruit flavored alcoholic beverages that are being advertised.
Well, it's the
This-
same thing with vapes.
That's what I mean. It's all being set up to where the advertisement is for youth.
Yes.
Yeah.
It is predominantly trying to make sure that we impact and sell those things. Because it's not, I will have to admit, the first time I ever had a hard liquor, straight was like, whoa, I'm not sure I wanna do that anymore. But I'll tell you, you put a bunch of fruit juice or other stuff in things and it becomes, even, I'm dating myself, probably, but there was a lot of Everclear punches way back in the day. And that is basically alcohol that's designed to burn brain cells even worse. So, and the vaping is the same way.
Mhm.
How do we, whether it's any of these things, start getting lead turned ahead of these? Because again, the initial part was, hey, vape instead of smoking
As an
But-
alternative.
as an alternative, but common sense told you you can put anything in them, you can put more caffeine, you can do anything you want. After the last meeting, when we talked about this,
Mhm.
I was at another meeting, and I forget what building I was at, but I happened to walk into the men's room, and they're sitting on the paper towels and stuff was a vape. Just how we talked about in here. Easily accessed, it was sitting there for people, I'm sure it was it may not have been, but it sure looked like a community vape.
Right.
Boy.
Yeah.
But again, this is, and I had never noticed it except we had just finished the meeting.
Yeah, and so I guess you're better at these logic models than a lot of us. And so bringing stuff like this, because I don't know if that's a condition or if that's a cause.
The perception of low risk of use and is a root cause.
Right, but this is different. This is purposeful misinformation. It's not a perception. It was rooted in reality. And now it's coming out that it doesn't. It goes back to that discussion about this is your brain on drugs. Somebody tries marijuana and they didn't die. So then they're gonna go try coke or they're gonna go try whatever. Same concept. This is healthier for you. And now we have an epidemic, so to speak, of people who think this is healthier for them. They've given up tobacco, but now they're here. So it's not a perception. It's their reality from what they were told, and now we have to change that reality
Right.
through research.
Mhm.
So I guess and it's different to me than a perception.
Oh, no,
But
it's
that pers-
different.
Yeah,
I think
It-
for young people too, there's also a discretion element, like, it does, if somebody smokes cigarettes, as a non-smoker, I can smell it from 20 foot away sometimes, it's strong, marijuana even stronger. The vapes smell like Jolly Ranchers, I mean, the parents don't know,
oh, I know what it is when I'm in the car and my kids use them, and I'm like, stop
but it's
it.
not quite as strong.
But
as-
if I'm out in public, I don't know, it's like, oh, that was just kind of a pleasant smell.
Mhm.
Knowing that I'm breathing that in, if I can smell it, I'm breathing it in.
Right.
I'd like to hear from our youth. I mean, we got Jenna and we got our two interns.
Mhm.
What do y'all believe? I mean, to me, and again, I'd like y'all to enter into this discussion. To me, our media has been, shall we say, bought
Yeah, we can say
by
that.
companies and other stuff, because you can't tell me the science wasn't there earlier
Mhm, right.
about this. So again, what is y'all's perception, opinions, whatever, about what's going on with both alcohol and vaping? And how it has been sold to y'all, your friends, your contemporaries.
I mean, I definitely do believe that it's more targeted towards children and youth these days. One, because the bottles and stuff are more colorful and like have like fruits or little silly stuff on it and like,
Gadgets and they.
Even the
they-
commercial.
Electronic gadgets, they become electronic gadgets now.
yeah, and like when you see commercials, like if I see a Twisted Tea commercial, it's never like an old person. It's gonna be people my age or younger drinking it. So it's catered towards, you know.
The
youth.
20-something,
Yeah,
or well, probably actually younger, but they will say it's towards the 20-something.
yeah, very rarely do you see an older person, like in a beer commercial or something, drinking it unless it's like, what, Ryan Reynolds? Cause he's got his own brands, like an actor or something like that promoting it.
Alright,
And they also get famous people who promote these things because they're fans and some be like, I wanna try that.
I mean, they're also taking like popular like soda brands too. We've seen like Coca-Cola has like Jack Daniels, we've seen
Mountain Dew.
Dew.
Oh,
I
wow.
don't know.
The Ocean Spray has one, Sunny D, which is like a
The
children, I drank that when I was little.
Yeah, what
They have one now too.
A Sunny D,
Do
like
they
alcohol
make-
drink?
Yeah,
Are you
they
serious?
do. And it's almost identical to what
Well, but
our
and-
kids grew up with.
I
'Cause I
had
grew
seen
up
that.
drinking it, yeah.
so the root cause is capitalism.
Yeah, capitalism and media,
That's the root cause.
capitalism and media, capitalism, people can buy the media.
We can't topple capitalism.
Well, I almost got in trouble at work last week because I had a can of San Pellegrino on my desk. It's just lime flavored water. But it looks like a heart, it's circled back around to where they're trying so hard to make it look like the normal product, but the normal product
Mhm.
looks weird.
Somebody was telling me up in Michigan that their mom, who never drank alcohol in their life, they went over to her house and she was drinking hard seltzer. She didn't even know she was drinking hard seltzer. She thought she picked up club soda, flavored club soda. And they're like, Mom, you didn't feel that?
Just
It's-
confusing,
So,
yeah,
yeah,
marketing.
so it's marketing.
We've also seen some like crazy vapes, since we've been doing this. Like there was one, it had telephone, a working telephone, like in the vape. You can connect your
Video
phone.
games. I've
No,
heard
no,
them.
you can connect your phone to it and text and call people off of it.
Oh, my gosh.
I've never seen that before in my life.
Wow.
No, my kids have told me that they now come with video games, that you can play video games on them.
Oh, my.
And a lot
gosh.
of the vapes with THC in it look
What'd you
similar, if not
Somebody's in the
identical to
chat.
just
Yeah,
nicotine
so
So you
vapes.
don't know what it is.
Unless, like, there's a brand called Lost Mary. Well, I guess that same brand does Lost THC, which is the same. They just has THC in it.
Lost Mary thing.
Yeah,
Yeah.
so. You might not, you might think you're buying like a Lost Mary, which is just has nicotine in it, but you're accidentally buying one with THC in it.
And I think that also comes back to the discretion element. If it looks almost identical or hard to tell at a glance, it's not great for a teenager to have a nicotine vape, but it's really not great for them to have a THC vape. And if the adult can't tell the difference,
They
I don't
also
think you
make a
can tell the
little-
difference until they
start using a lot of
start
things.
using it. No, start using it. You can smell the difference.
Shelley just dropped a link in the chat box.
Channel 6 ran a piece on July 4th about the marketing of lookalike products for alcohol. Wow. So, I mean, we did focus on the vaping. And we did talk about, is there another focus we need to have? And maybe it is this availability of alcohol or lookalike products or something like that. I don't know, but
In the vape stores, I thought the two were closely married. I don't know, ladies, I haven't been in a vape store. I don't know if you're friends or the rest.
Well, in Virginia, they used to sell Delta 8 products. I don't know if it's.
I thought it was
Delta 8.
Delta 9.
Delta
10.
9 is the real weed and Delta 8 was the synthetic, like.
Yeah,
the
Delta
farmers.
8's the one that's, yeah.
And then I don't know the details because I don't go to vape stores
Yeah.
there, but I think that became outlawed, so, but it's still legal in North Carolina.
But a lot of
That-
people still sell it.
Yeah,
We've been in
Absolutely.
plenty.
We've been
that-
plenty.
that are selling Delta 8.
Yeah.
Yeah.
The flowers, the gummies, the.
All of it.
That.
I've seen some shrooms.
Yeah, well, they used to sell the Delta 8 weed, like
Oh,
grass, with
okay.
green stuff.
Boy, I'm out of date.
You're out of date.
Well, yeah, so, okay, I'm sorry, Jenna, we hijacked your
No, you're good.
presentation.
No,
Please
do we need
continue.
to, since we have all these wonderful partners online, do we
But if
need
you
to
can
go
think
over?
about that,
Sorry.
like as you're doing these logic models and let us know what you think as far as, is that like Because we can fix certain things, but I think it's more of a systemic issue. And how do we affect that systemic issue that we see happening? You know, Joe Camel used to be the biggest thing, and then no more.
Marlboro.
Yeah, I know now you can't use those characters anymore to push your cigarettes.
Well, there's
I
no
mean, the same thing
advertising.
as vaping.
You can't advertise cigarettes anymore.
Right.
But that was actually good for tobacco, manufacturers, because they cut their advertising budget and people still were gonna buy cigarettes. They were
Well, 'cause
already
they were
taking
addicted.
cigarettes.
Because they were addicted
Right.
at that point. I mean, and that's what's going on here. You're moving your addiction from smokeless and chewing tobacco to Zans, it's pure nicotine, well, you know, dosable nicotine and vaping. So what we've done is we've just moved the industry from, let's call it real product to synthesized product that is manufactured. And it's like, and so then where's that next step? How do you prevent that next step?
Janet's saying, okay,
When adults think and believe that these things are safer, they will most likely allow their children to get by with smoking the vapes and or drinking the fruity alcohol because it advertises this in false information. Yep,
Mhm.
agreed, Janet.
right, yeah, the kids are less likely to care about the risks, right, because they're, frankly, what hasn't developed yet.
And,
But
and
the
their parents
parents-
are doing it too.
But if the
Yeah.
parents' fault, it's the parents you have to convince.
Well, what the marketing company knows is research tells, if you can keep a young person from having their first initiation in any of these substances to be over the age of 19, the odds that they will develop a substance use disorder is significantly lower. So as we found in some of the conferences we've been to, in recent months is, if you really look at the data behind who is buying the largest amount of alcohol and those who gamble, you look at the demographics of those folks, they tend to be the problem users, which is part of what never gets advertised. So if I can get you on a vape before the age of 19, the odds of you becoming a lifelong user and what we would term as a substance use disorder is so much skyrockets.
The younger
Versus
the
if
age.
one of these ladies, now doesn't vape and they're both almost 21 or 21. The odds of them developing a substance use disorder, becoming addicted to the substance for the course of their life
Cause
is
they're,
significantly lower.
and that science,
All brain science.
the science has to do with the fact that then their brain isn't accustomed to
Right.
coping
Right.
using those mechanisms.
Well, not
Yeah.
just that, but so much of addiction or substance use disorder is habit. I think I've heard from people, the hardest part about quitting tobacco, quitting alcohol, whatever, isn't necessarily the cravings, it's, this is what I do right now.
Yeah.
I get home from work, I open a beer. I get home from work, I light a
Well,
cigarette.
vaping is the
Now I'm
hand to
off work,
mouth
what do I
action.
do?
All the
Yeah.
time.
Yeah,
That's
oral
what all of
fixation.
my friends have
The
said.
oral fixation.
Yeah, it's
Yeah,
not the
oral fixation,
nicotine, it's
right.
the fact that you just sit there and you can do this all day and that's the problem.
Right, but if they know the data that we know behind, if they don't, like you said, if the marketing, that's why it's all fruity flavor, that's why because if they don't scoop that demographic in, because remember, those people are aging up every day. They gotta scoop that demographic in every day, all day long.
Somebody in the waiting room.
So can we want to get back to where you need data points for a lot of our partners on here? Like, can you share with us who we all need to be talking to about getting some of those missing data points that you need?
Yeah, I think that some of it's gonna be creating something to send out to the community to collect data. 'Cause,
Oh, okay.
I think we're gonna have to make like a youth survey or something like that, which
Okay.
I'm going to mid-year next week, so I'm hoping that they're gonna have some ideas
Okay.
about stuff like that.
Okay.
What are you going to?
But do you want to go back and see what they are let me go back and look at what the missing points are?
Yeah.
Just in case anyone online, anyone in the room has partnerships with any of those. Like you said, we need to have more than one, just to see where we're missing stuff. Does that make
Allison?
sense?
Allison? You there?
Yep, I'm here.
You from the military side? Cause I'll tell you one thing, we have a huge 18 years old when they come in, male and female, first time away from home a lot of times, the stressors of basic training, all of the rest, there's a lot of them that have never, ever started and all of a sudden now are big time users. What do you have that Jenna might be able to use?
I don't know of anything offhand, but I haven't looked into it. I'm happy to try to search and see if they have any statistics about vaping. And I guess we'd be talking about not necessarily veterans, but those on, those that are in the military.
Normally, the active duty, we do, as you know, we do a whole lot of surveys and stuff just to see, we may be able to tap into that and get some of those numbers, which will help a little bit for Jenna and all.
Yeah.
Cause I'll tell you, you talk about introduction to alcohol in my day.
Right.
I think
And
it still is.
smoking.
I think it still is.
Yeah.
I mean, that was the first thing I learned as an
Right.
18-year-old was smoking in survival school. And then 18 years old, the places with the beer and stuff, it was survival,
Yeah.
Yeah.
And these
Right.
18-year-olds all of a sudden have relative
Freedom.
to where they were before,
Freedom.
significant disposable income.
And
That may be
freedom.
basic for
Right.
expended.
Yeah. Very
Yeah.
true.
Yeah. I'm happy to look at DOD and see if they've got some data on that.
Thank you.
Awesome. Also just a reminder though, that we are looking for our county specifically. So if we don't have that, that'll just be something we can add to that we need to like look out for, because I definitely think that's something we need to look into, but it will need to be like county specific data and youth specific data, so under 21.
Yeah, I was thinking, Jenna, that if we got some numbers, what we do is use those numbers to see what we're getting from our county.
Yeah.
Because that would give us something to extrapolate and go, if it's these numbers here, ours are looking either way too high or way too, in other words, just as a baseline.
Yeah. No, I agree. Absolutely.
And one of the things I love is for our interns too, before they head back to school, they should have some ideas of how we tackle I use the term successors. In other words, you're not that far away from 18. Some of us are a long, long way. And then how do we use y'all's experiences and stuff? Because trust me, y'all are a lot more, how would I use the word? You're a lot more accomplished. You seem to be a lot more mature than a lot of your peers. And so y'all being able to help us develop those kinds of things would be a great boon. In fact, I wish y'all were around during the school year, because I bet you it would help Jenna. And when we go out to Mecklenburg and that stuff, because, even when I was in school, all it took was an individual that was in college or shortly thereafter.
Right.
We don't listen to our parents, but
Right.
we would sure listen
Oh,
to
yeah.
those that are there.
Okay.
So, that's the part. If your contemporaries, others that are as well accomplished as y'all are, if we could get y'all to come back to assist.
Wait,
Wow.
they sell them for $20 at school because parents buy them for some kids and then they do it in the bathroom in Henry County. So
Do you
it
wanna
seems to be
speak, Amber?
typical.
Yep.
That was Amber.
Do you want to speak, Amber? You have your hand raised.
What does that say? I didn't see them.
Yeah, I was just wondering, have we thought about going to like a school board meeting and seeing about I know back in the day, we had bathroom monitors, because not only for vaping, that's where they're going to fight. So,
Yeah, we had some in the meeting that we had with the community at large, there were some teachers in here and I was kind of surprised that there weren't monitors in the bathrooms
Yeah.
at schools.
I think they're supposed to be teachers. And
Yeah.
then the teachers are supposed to be there, but they get busy or they have to go to another classroom or they have to take a bathroom break.
Or they have to deal with this when
Yeah.
they're
Or,
something.
yeah.
Kid
or-
had
and then-
questions. Yeah.
Right, and then sometimes, they don't want to, and fair enough, so, yeah, I think, yeah.
which I mean, it's understandable, but I mean, we really do need that to be enforced, because it's getting out of hand, between bullying and vaping and all the things.
It says juveniles can possess the vapes and tobacco without a criminal charge, so they can call it tobacco, but they have no consequences. Yeah, they have consequences from the individual
So
school.
when we do
Yeah.
Were you reading?
I was just reading the comments.
Oh.
No, she's right, because that's what we talked about a lot on the 20th,
Yeah.
because then Kim Gordon was here as a
Yeah.
teacher, I was the teacher in Halifax and Mecklenburg. Absolutely say that where you can't put cameras is where the kids are gonna go. And then when you don't have cameras and you're an adult and you're in an area where there are no cameras, you also have to concern about what you're gonna be, doing, right? But definitely, it falls another thing on the staff. Yeah, I can remember being a bathroom monitor here and there. And between teaching, the hallways, who's in the bathroom, you get 10 or 10, then trying to monitor how many kids go in the bathroom, they give a time, who hasn't come out yet.
Yeah, they were talking about, they have software where you can schedule a bathroom break and they make sure nobody else is in the bathroom at the time you have that.
Oh, wow.
Yeah, that was in that, they were talking about that when we had our, and it's like, does it work? And they were kind of like, well, sort of.
Well, I know at Mecklenburg, they started doing like a bathroom system where it was like some kind of website and they had to request a pass online and the teacher had to accept it and you had to go to a certain bathroom. So that's how they found it, I guess.
Right, like
Not
if you
as
and you wanted to go to the bathroom, they'd send
Right.
you to one and you to the other one.
Yeah.
But how do they know
Wow,
if you
how much
actually
time are you
did that?
teaching if you're monitoring all that?
I guess only if they
Wow.
find you in the wrong one.
Amber says maybe they need to
Yeah.
hire someone out of the budget to just be a bathroom monitor.
Oh, absolutely, 1,000%
For
agree.
sure, a lot
It's
of
not-
auxiliary staff.
School boards are already right now overtaxed and over.
Right,
There's-
right.
The money
right.
is so light. And the other problem comes in is, even if you catch them, 90% of the time, there's no consequences. Because we've,
Well, yeah, I mean, what do you?
we had the coaches with the paddles and all the rest. Now, there is no, is there any discipline in the school anymore? We know
I
that?
don't think it's
You
about
get
discipline, it's about
suspended.
making sure that the policy is enforced and upheld.
Yeah.
But I mean, a lot of times teachers are just as guilty. I know plenty of teachers who vape or like go on breaks and stuff like that, or go to the bathroom too and vape.
Oh, wow. Gotta love the next generations. They just can't buy the vapes or tobacco.
Well, no, they're getting it
Amy
somewhere,
Trent coming in
but
there.
they can buy it because,
Yeah.
I mean, they can buy alcohol, so they can buy vapes.
There's a lot of places around too that, like, they'll make friends with people who work the counter at these vape stores and stuff like that, so they'll just sell it to them.
Right.
And it's often relatively young people that are working at the vape stores too.
Or just trying to keep.
Well, it goes back to that where we talked about, should it be kind of like some organizations have the requirement that we card everybody for alcohol. To get that to be a statewide initiative, we card everybody, whether you're.
Right.
Well, it is. I mean, that is currently the regulation.
But it
Well,
may
no,
be
they,
that
no,
they
it's
scan
not,
the
we card
ID.
everybody, you only have to card people that look.
Oh, no, you're right. Card under 27. Anyone who looks like they're 27 and under.
Right
Now
now.
it's 40 and under.
Mm-mm.
No, it's 27 right now. But I mean,
like, I can't
number.
tell.
I know, it's a weird number,
I
but
can't
it's
tell the
really
difference
implied to card
between you
everybody.
two.
Yeah.
We're
I
the
mean-
same age.
Oh, you two are the same age?
Mhm.
Okay, yeah. that's
Okay,
right.
so can I ask a really ignorant question? So how old are you two?
We'll be 25 in September.
Okay,
And you're 20, soon to be 21
Next year.
next year, okay. Yeah, I mean, like, I can't tell.
I can't either.
Right, which is why everybody should be carded.
To me, they're all babies.
Everybody should be, yeah, right, everybody should be carded, right.
Yeah.
Remember the day we all got laughing, the day that all four of us went out, I was
Oh my
training them
God.
about how to do the tobacco retailers. And remember that gentleman at the vape shop?
Yes.
When I made the comment, when he was questioning about IDing folks, I said, you should be IDing everybody. And he looked me dead in the face and said, I'm not IDing you, but I'll ID the rest of them.
Oh.
And I was like, exactly. I said, exactly. I'm good, you're not gonna ID me, though technically it would be a bad policy. I said, but you're definitely gonna ID these three ladies, because you see, there's a big gap in their age. And he said, yes, I will ID them, but I'm not IDing you. I said, okay, I can live with that.
Amber says she never gets, she never gets carded these days, and she's 36, and it's kind of offending.
No, I agree with you. I think you should.
I'm the opposite. I get carded every time.
I'm almost 40. I think they should.
Yeah, I'm, this week on vacation, my daughter got carded all the time and she'll be 29 in a week. Yeah.
Yeah, I never got carded 18 and beyond.
Right, well, Stephen, I think I really
I got
go
carded at
to,
16 and beyond.
and as I know Jamie talked to us about a little bit this at the meeting that we had on the 20th. He talked about, I think, the understanding that folks are going to card and there are folks who are not going to card. And when we talked, you know, share the data, when we looked at, put that back up there for them to see if you don't mind, is how, if you look at the data about our violation rate, so as you guys know, what the ladies have done over the last 2 months, and they're very shortly, in another week or so, gonna be finished. They're visiting all the local tobacco, alcohol, and gambling retailers. And they're bringing them some nice items, counter mats, posters, stickers, thank you notes, and then basically reminding them that they have an obligation to ID when they're selling any of these products. But yet Jenna can show you over what the violation rate is in our area, which is very high. Now, Jamie described, y'all correct me if I'm wrong, but Jamie King from Mecklenburg described that when they do inspections, so we weren't doing inspections, we were doing an environmental scan, giving them materials, thanking them for their good works of IDing everybody, and then reminding them if they were confused by what that meant, that you should ID anyone who appears to be under the age of 27. Jamie then said, when they do violations or go into a store to conduct an undercover violation with someone, Jameson said she's 20, right? So Jameson would be a perfect candidate for that, right? What he says is an officer walks in the store and walks around and then to make sure the environment is safe, right? Then he sends the underage person in, dressed as an underage person, to purchase. And while that person's in the store, the officer walks in again, okay? So in my sort of hearing that, thinking that then if I'm not gonna ID you, I'm gonna sell to you, and there's a cop in the, I'm not talking about officers, I'm talking about the clients. And there is
Nobody in there.
whether I've noticed or not, there's an officer in the store. My ID, Elena, is more about what I do every day, muscle memory,
Right.
right? It's not because I sell some days because of her look or her look or her look. I really feel that goes back to local culture, goes back to local norms. It goes back to, that's what I do every day. If there's 6 or 9 people, if there's 10 people in line, someone walks in, it's just muscle memory. I'm doing that. I'm not IDing because I don't ID. That's what I heard from that. So we kind of want to look to see where the other data points are to support the fact that we've got to start having more conversations with local retailers than these 2 women have done over the last 2 months.
And do we need to sit down with the school board, sit down with Scott, get Paul to put us on his calendar? And then sit down with the principal.
I think once we have a plan in place,
Who's it now? Who's the superintendent?
it's Warner. Yeah, Scott Warner.
We don't actually have access to the school and we don't have a survey.
Okay, so what data do we need? I'm sorry, we got.
Do you need access to the school?
We
Okay,
need Brunswick. I think we have Mecklenburg and Halifax, okay, right
you
now.
need Brunswick?
I think so.
All right, well, what we'll do is we will call Mr. Warner
That's
or Paul,
for what?
for them to go cross over to Brunswick, if you need the Brunswick information.
True, but I don't wanna have a conversation with anybody until we know exactly what we need, or until we have a survey
that
ready,
we can.
so that we
right,
have
that
data,
makes
cause like we
sense.
already have. Unless people have a relationship with somebody, cause that's
I
totally
mean, I have
fine,
a
but
relationship with Scott, but I mean.
you would need data.
I
to-
want yes, exactly. If I were to have a conversation with him, I would want data.
Right, and that's fair,
Right.
yeah.
Well, no, it's the same thing, I mean,
Yeah.
whenever we're ready, because again, as part of my cooking, I've cooked for both
No, a lot.
Paul and now Scott, I've cooked for the school board more than a few times.
Okay, cool.
Right,
So that gives,
Okay.
us access, yeah,
Yeah.
that would be great, yeah. Yes.
Okay, all right, back to what you were saying.
So,
good.
so even though the way they do their undercover work, I think in some ways would be a little suspect unless that person was plain clothes.
Well, to answer the question, because of what conversation Jamie had on June 20th, we have requested a meeting with the local inspector that covers our area and his team.
Okay,
So to be transparent, we don't want to make any assumptions about anything.
gotcha.
We just listened to that conversation, took away some basic things from it, just from our perception of what we heard. We have requested a meeting with that inspector. We hope to have that meeting during the month of August.
Okay.
We've got those channels rolling, and we're hoping to get a meeting with that gentleman sometime by mid-August. To
And
really
then-
talk to him about what they actually do.
It says Brunswick superintendent changed, it's now Darnell Collard or Dr. Darnell Carter. Okay, so we
Yeah,
got
we
that.
probably missed some other.
Is that the same Dr. Carter that was, Bluestone?
Yes, yes.
Wait,
Yes.
Oh, really?
Yeah,
Yeah, Dr. Carter, he was
our
at,
senior year.
yes,
He was in-
was that Bluestone years ago?
Yeah.
Yes.
yeah. I have met him a few times. When I was
Okay.
looking for data participation, I got zip, but.
So are you set with what you need for now? Do you need anything from the coalition members at this point?
I will be reaching out to people that have data, that I think they have data to fill in what I don't have.
Okay,
The next steps would be,
maybe.
what do I need to do to collect the other data, which would probably just be a survey. I wanna ask them there, what's the easiest and most concise way, because I don't wanna do like 17,000 surveys. I'd
Right.
rather just do
and
like,
the thing is, I mean, if you're not accustomed to writing surveys, there's a right way and a wrong way
right,
of doing it.
exactly.
And because you can ask
can
too
lead
many
people,
leading
yeah.
questions or whatever, so if you all have in-house somebody who has that skill set, that'd be great.
Yeah, Dorothy actually does that kind of consulting, so
Good.
that's who I would probably
Dorothy to
do
consult,
next. Yes.
awesome, okay.
Okay.
That's at least the idea. So
Okay.
yeah, I guess next steps are really that, like, I'm gonna reach out to people who may have data. If they don't have it, then I need to fill in those data points. Then we will go back to we will have an evaluation plan then. And then we need to go back to our 7 strategies, pick which one we wanna start with, and then we'll move down the line like that.
Okay.
I think, if that's cool with everybody, I think that's the most concise way to move forward, but.
Okay. Oh, click the more comments. about
Yeah,
chat.
yes.
the only caveat I would say there is might be some that
You got
have
an arrow.
some commonality.
Oh,
And
yeah.
if we can tackle the ones that are common at the same time, maybe,
Yeah,
but yeah. See
Yeah.
what ones have some overlap or.
I agree. I think the retailer stuff, even if we don't. This is not CADCA, but even if we don't have the research, saying that we're like specifically tackling alcohol and stuff, we know because of counter tools, it's already an issue. So I'm totally cool with us putting it together in one thing, because we're a small team. That's what we do already, is do an environment scan of everything, and we
right,
do that.
right.
So I'm fine
Okay,
doing stuff like that together. I'll just work backwards and rewrite it for,
in the
yes.
future.
Yeah.
Future.
Oh,
Yeah,
that's
yeah.
a valid
So I'm
point.
cool with that.
Because with our small team, we could, in an ideal world, go out and do tobacco environmental scans, and then go back out and do alcohol
Right,
environmental scans, and then go back out and do the problem gambling environmental scans.
but we could do it all at once too.
Right.
That's what we do.
So if it's something
That's
like
what we
that,
do,
I'm
because
totally
we
fine with
just,
us
I mean, the
just,
hours and the days it takes to do that. And because also, you're going to 99.9, the same places.
Yeah.
The places that are selling, other than CVS, and other than a few folks that have not yet adopted lottery. Primarily, would y'all agree, primarily, more than 90% of the stores that they visited in the last
Start doing all
90 days.
50% of our stores sell
Yes.
vape.
Yes,
50% of our tobacco retailers sell vaping.
Right.
And then like, I think 80% sell alcohol.
right.
So, yes.
So you're
Okay.
visiting the same
It's a big
places.
group, okay.
And if you look at it now, look at all the advertisements for gambling.
Right.
And it has the little thing down at the bottom. If you have a gambling problem, please call 1-800
And
game.
if you notice, it takes the exact same trend as nicotine, which I find
Yes.
very interesting.
Yes.
Yeah, it's done the same thing as cigarettes. We just.
And
go
the same thing as
with-
vaping.
Yep.
It is,
Well, because we know,
it's a proven marketing plan.
Mhm.
they know it works.
Yeah.
And there's no
Well,
bans. They just move from something that's
They-
banned to something else.
They get ahead of it until it catches up and then they're behind and then they go on to the next.
And by the way, if you see any gambling machines on in a retailer, which ladies have seen, those are illegal. They're not supposed to have any gambling skill machines separate from Virginia Lottery. And if they do, they are illegal, and we've seen quite a few. So,
Amber has her hand up.
Yes, Amber.
Shavonda Stitch is the lead school resource officer.
Yes.
Okay.
and then.
Shonda Hardy is the intake officer with DJJ.
I can print all these comments
Yeah.
out when the meeting's over for our
Thank you
minutes.
guys for that.
Yes,
Thank you, Janet.
Thank you.
Next school board meeting in Brunswick is August 11th. Okay. Thank you.
Amber, you wanted to say something?
Yeah, I was just gonna say, like, the way you were talking about those machines, they're saying them as recreational. I used to work at a convenience store and he actually went to jail because of those machines. Because they say it's recreational, but they're also paying out at the register for them under the table. So that's a big thing. And I know there is one, on the main road from Danville, is that 58? From Danville to Martinsville, and they have the games in there. And so I know it's like a big thing. And there's pretty much not nothing that they can do until someone goes in there. And the way that my old boss got caught was because her husband got upset that she had lost all their money. So it has to be someone that goes in and tells on them.
Right.
Well, in gambling now, they've got all sorts of online,
Right.
which makes
Yes.
it even that much
Which
easier.
almost all online gaming is illegal, correct? Unless if it's VA lottery.
Right.
Yeah, it's all illegal.
Even like DraftKings or something like that.
DraftKings is not illegal because it's sports betting. But
But
yeah.
all these caveats.
We've been trying to do a deep dive, I mean, with
But
all our
it's supposed to
trainings
be
and
all
events,
online
we're trying
casinos and
to
all that
But I
kind of
see
stuff.
that.
understand all the
I mean,
Online
caveats.
poker, is
There's
that
so many
illegal?
caveats.
But I see that on my grandkids' tablets, the
Yeah.
online poker.
There's
and
so many
stuff.
different
But they're not
caveats about what
winning
they
money.
define as
Yeah,
illegal.
you can play as long as you don't win money.
They're winning coins.
As long as you
Yeah.
don't win
They're winning
money.
coins.
Nobody wants to do, right?
But see, that's just it.
Okay.
It's still,
Well, it's
it's still
instilling.
instilling a gambling mode.
Oh,
Right.
absolutely.
So
That's
it's
what a lot
learning.
of the gaming
Mario
is
Kart,
too.
I mean.
Right.
No, absolutely. Yeah,
Going
and
after
all of
the
it's
coins
unregulated
and-
too. Yeah.
Right.
Getting to
Totally
the next
unregulated.
level and, oh, yeah.
Oh,
But I was also gonna say, on like the Sheets app, you can order vapes and stuff like that. So kids can get on their parents and go through the drive-through, because Martinsville has a drive-through now, and just pick it up. Like, they're not carding. You ordered online, it was verified online, and then boom, they've got it.
Dash does similar.
Yeah.
but we don't have that here.
Door.
No, but like
We
if
do actually have some DoorDash.
South Boston,
Yeah.
South Boston does that.
So does,
And we
South
have,
Boston does,
so
so
does
does
Street.
City. There's like two or three, yeah.
Yeah.
Farmville does too, cause you know, they have all those kids up there, but you can, I don't know if how they check, but you can order like alcohol or anything like that from like Sheets or something like that.
Yeah, they put in your app, you put your license in there, and they're just like, oh, you're good. And they just put in your order and then hand it to you. So as long as you have that phone and that app and you've checked in, you're good to go.
Okay. All right.
I think this
talked
was
about the
very
readiness
productive.
assessment.
Yes, I will move on to the readiness assessment.
So as she's bringing this up, I know you all remember that one of the tasks that we were required to do, which is always good for us, from January of this year through April, was we send out to anyone who's been actively participating in the coalition over the last 2 years, a coalition readiness assessment survey, which comes from the state, not designed by us, it comes from the state, to basically give us the opportunity to ask people questions about what is happening in our coalition. So between January and the end of May, and the deadline, I think, was mid-June, we then actively sent out this personalized invitation to everybody. And provided them with an incentive if they shared their information, because you had to share. Your information did not go into the survey, it was totally anonymous, but if you then shared your information with a screenshot that you took the survey, we gave you an incentive. And so Omni released this data to Jenna just a few days ago, a week or so ago, maybe a few days ago. So she's gonna share with you the overall perception of our coalition from those that completed that survey. And again, these were folks that were active members and or attended a meeting over the last 2 years.
Great.
Okay.
We had 100 people answer the survey. This first question, which is the primary issue of the coalition, most people said alcohol misuse, tobacco, nicotine misuse, suicide prevention and mental health. Most people did not say prescription drug, but there was a couple people, and then other people wrote in problem gambling, substance use, and veterans. We had a whole bunch of people say all three of those things. Pretty much for every single stop the way so you guys can see. Every single one of these questions, pretty much everybody said agree or strongly agree. So, and this is just about our coalition and kind of how it functions. So is it critical that our coalition addresses the issue? Most people said yes. They have top priorities and its impact on the issue. Yes. This is all about coalition structure. So the membership is equal, essentially. It's got a lot of different people in the community. It's not overrun by one organization. We've got good information. Everybody works together well. We've got ground rules. We've got standard ways of communication. Everybody said yes to all of those things. Our leadership team had very positive. This is just about that you guys are just working well, and they said yes to every single one. That you guys are fair, you communicate well, we do good work, all that kind of stuff. Everybody said strongly agree or agree to all of this stuff. Membership engagement, that's just people coming to the coalitions, but also that we have like trust. We give people chances to talk. They're good representations of their organizations. Everybody is talked to about decisions. We do voting, that kind of stuff. Understanding roles, share workload, that kind of stuff. Everybody said agree to all that stuff. Coalition process. That's just being open, talking about decision making and opinions, being able to discuss different things. Everybody said yes to that. Coalition results. Oh, that's just saying that we are effective in our community. Everybody said strongly agree and agree to those. Everybody said strongly agree and agree to all of these, just in case you guys wanted to know.
So that's kind of an anomaly that we had nobody who had any feedback that would help us perform better.
We had, we have some written
comments,
in,
yeah,
and there
yeah,
are some
there are
people
some
who
written
did like a
comments.
2 or a 1 or 2, but it was very, very few. I mean, out of like, there's probably like 3 out of like the 100, and some of those people didn't even say how long they had been in the coalition, so I'm not sure that they were actually a member, but yes, most people
I got you,
just,
I feel
yeah.
what you're saying. But where were those, in what areas? It's all well and good to have strongly agree. I'm more interested in where people didn't agree. So
Right.
that we can determine whether or not it's valid. And it's something we really need to work on, or if we need to discuss it and come up with ideas, or go, yeah, you're like you said, well, it's only 2 or 3, but to me, that's important feedback.
Right.
And I'll tell you right now, I don't personally believe that I've been a member of the coalition long enough to have been able to make the survey. because I didn't believe I had enough information as to how effective or whatever we are at this
Right.
time.
Sure.
Yeah.
Because I'm watching this get going, but I am my concerns are we really don't have access to the youth. And are we really getting the results we need? I mean, now that we have Jenna, now that we've had the 2 interns and stuff, but from what we discussed when I have first got here and the rest, I have been very concerned that we are not
Right.
that much engaged. Because that's where I believe we can, that's the results we
The
need.
big bang for the buck.
Yeah,
No, and I mean, and we are, so it's, I think, fitting in with when we had the consultant in. That is where everybody's focus seemed to go, was to the youth, and how do we make an impact there? Seeing as we
Right.
have finally gotten our foot in the door and maybe have some leverage there.
Yeah. Some traction.
Yeah, some traction, yeah.
Yeah. No, exactly.
just my thoughts.
No, totally.
No, yeah, no,
I
that's
hear ya.
fair.
Absolutely.
Fair enough, fair. Well, and then the other thing is you're kind of also grading yourself, especially if you've
Right.
been involved in the coalition for a long
No,
time.
yeah.
So,
I think we're effective because I'm effective.
right, I don't want to be not effective, right?
Right. Did you have, so you're gonna share some of the, yeah.
Yeah, because there was some write-ins. Most of the improve was participation in events and meetings and outreach in the community, reaching more people for events, having a bigger membership, reaching out to more partnerships.
Having members more involved.
Yes, that kind of stuff. That was pretty much. It was worded differently sometimes, but most of it
that was
was
the theme.
was
That was the
engagement.
theme.
Yes.
That was the
Yeah,
theme
yeah,
about
yeah.
engagement from the membership.
Yes,
Okay.
most of it, yes. Yeah. The only thing that wasn't as high as everything else was our coalition has access to power within legislative and executive branches, but we knew that already and we were. I mean, we don't have local government really in this
No, we don't.
coalition.
Yeah, I don't know.
So
Yeah.
that's a fair.
Are you
Yeah.
saying like local is in the board of supervisors?
Yeah,
Are
all
you
that.
saying local
Yeah,
is in
yeah.
the like town councils?
That too.
Mhm,
Okay.
mhm.
Yeah.
All right.
Yeah, that was the one thing Jenna and I talked about when looking at these, relatively kind assessments. That the one that missed the mark was, what if anyone said that we had power within local government, and we don't. We don't have anybody that serves in the coalition. We've never had anybody serve on the coalition from local government. And that would certainly be something that, again, I think would benefit us in a great way. Would probably also get us access to more data too.
Sure.
So that's something to consider, that we
But
thought.
Jamie's already made strides in that direction anyways, because he already talked to the judge and stuff like that.
Right,
So, I mean,
right.
yeah,
Jamie
it doesn't
came,
end there, but still,
Right.
I mean, we've already.
Right, and it doesn't have to be a board of supervisors. You're right.
No, it could be any
It
leader,
could be
any
it
leader.
could be
And
somebody on
Tammy
the
Hawkeye
team of
literally
the
came to
prosecuting
our-
Yeah,
attorney.
Tammy.
I mean,
Tammy has already come. I mean,
Yeah.
would it be worthwhile to get her legislative assistant, Holly, who lives down here, to become a member? The same thing with Cade?
We
Because
could, yeah.
Cade's,
Absolutely.
Kate
Gravitt.
Yeah.
grab it,
Mhm.
yeah.
in other words, those would be the 2 individuals because they are familiar with the area. They grew up here, so they would be that's who we probably need to talk to
Right.
get them involved.
Mhm.
Because if they show up, then they will pass it on to theirs, and it would be the same thing if we're trying to get the local. We may not get the board of supervisors or the county commission, but get somebody from those offices to then at least be a representative.
That'd be fantastic.
Yeah.
So I will take it upon myself to contact Holly and see if her and Tammy, if Holly might be able to take the time, because at least then she can pass it on to Tammy as to what we're doing. Does anybody, I know Kate, but I'm not as familiar with him.
I don't know Cade really well. I know his mom better than I know him.
Oh, that's even better then. No son is gonna tell his mom no. That's almost as bad as telling your wife no.
All right. Right.
And I don't know who's over in Brunswick. I don't know who has that area.
I'm sure Jeanette knows some people.
Okay.
Yeah, Jeanette said you're right. Okay.
You
Probably Shelley. Shelley, do you have any ideas either?
I can't think of any off the top of my head. If I think of any, though, I'll email you.
Okay, thank you.
Okay, any other questions about June 20th, CADCA, the Coalition Readiness Assessment? Time for leadership updates?
All right. I'll start here. Well, first and foremost, I'm not sure we have introduced everybody to our latest leadership team member. Dennis Damians, he has filled Will Stembridge's spot. Will had to resign due to other conflicts, mostly his job and his fire department role in Wiley'sburg. So we were lucky enough to have Dennis join us on the leadership team, so that's one. Second, I'm not sure if it was discussed in the last meeting, but the bylaws did pass. So the new bylaws stand, which will make it easier for us to vote and get things through committees, so we're excited about that. And then really, that's the only thing I have. As far as leadership updates, anything? No, Elena? Kenan?
Well, I know we have a number of different trainings coming up. Next Saturday, Janet is hosting the combination CPR. Let's see if I can find it. Hang on one second. Online. Yeah, here we go. The dual training on it's July. July 26th, next Saturday at the Vibrant Church in South Hill. She's got 30 people registered and still have 20 open seats. That's getting 2 trainings in the same day. Revive training in the morning, which comes with Narcan, the kit, and then after the lunch break, CPR training, the non-certified, hands-on training, not the certificate, the CPR, costs, certification CPR training costs a fee. But this is, hands-on choking, it's still life-saving information, it's just not the certification level, and of course, the length of the class. But really good, for anyone that, doesn't know anything about helping someone who's choking, not breathing, that type of thing.
Somebody who needs CPR is not going to ask me if you have a certification first.
Right, exactly,
But the person choking or.
So we greatly appreciate Janet, putting that together. And, again, we're looking for more folks to attend. All I have to do is let Janet know. It was in the newsletter. Those of you in the room, there's copies of the flyer in the back.
Do we have electronic copy?
We do.
Can you send me an electronic copy?
Absolutely.
I'll get into SBCC because they have folks over that way.
Okay,
They
okay.
usually can share stuff like that fairly
Awesome.
easily.
Okay, Catherine, Amber, okay.
We could share it to the
Cause
hospital.
there's plenty of people, I know when I worked there, it was mandatory to have CPR training.
But they have to
Probably
be
don't want
certified.
They probably want the
Yeah,
certificate.
they can't be uncertified.
And usually the hospital doesn't pay for that.
Yeah, right.
Yeah.
But I mean, the Revive though. Some of them
Oh,
folks do
that's
that.
true, yeah.
And even if you do have a certification already, it's good.
Amber, you wanna drop your email in box?
Oh,
too?
Janet, thank you.
Okay. And then, in addition to that,
Have we passed that on to the sheriff's department,
Absolutely,
the Revive and the CPR?
absolutely.
Okay.
You're welcome.
and then also, just so y'all are aware of what's up and coming for the events. Again, they're all in the newsletter and there's flyers in the back as well. We've got the RACEAP Support Over Stigma Advancing Drug Use, a Drug Misuse Prevention Conference next month on the 27th. That's free and open to the community, and I'll share that in just a minute on mine. We've got our next assist class here at this building, September 3rd and 4th. It's a 2-day suicide prevention safety planning class that's coming up. Next week, as well as each additional 3rd week and all the way to Christmas, we're still hosting our virtual Revive, where people can come and get Revive training virtually, and then we deliver the Narcan kit to them. And then, Caitlin Maloney is sponsoring us again, going back to SVCC. We're conducting Lock and Talk and Revive training on the campuses of Keysville and Alberta again in September.
Who's that?
And then a new class that we're launching because of requests in the local community. You know, we always teach, I have trainers, and I'm also trained in to teach the adult mental health first aid, the youth mental health first aid, which we hosted, I think, 9 of those we're in like a new fiscal year, so it throws me off. In the last 9 months, we hosted about 9 of those. We are, because of many requests over the course of 3 or 4 months, another trainer and I applied for an application to teach older adult mental health first aid, that's teaching suicide prevention skills aimed at adults from 60 to the end of life.
Nice.
And so that class is gonna be August 27th here in this room. Unfortunately, it does conflict, which I didn't anticipate, but it does conflict with this event. They're both the same day. But if you know of anybody who's interested in the class, it is filling up quickly, and it's an all in-person class. There's no virtual component to it. So it's gonna be a long, 8-hour day, but that's okay. We don't require people to go online, do all that pre-coursework. Because it's the older adult population group.
Amber has a question.
Yeah, okay, and I'm gonna go ahead and share all those.
Go ahead, Amber.
Sorry, I'm such a talkative person, but lately in Henry County, they just did the harm reduction, did a in-person like STD testing and gave away a gift card at one of our local hotels that are known for drug use and prostitution. And I was just wondering, is there anything in the area here to do that?
Yeah, can you say what you did again? What did they give away a gift card for? I missed what you said.
They gave a gift card away, and they did like HIV testing, Hep C, like the STD testing type stuff.
That'd be interesting.
That
if
would
we
be
could
an interest,
collaborate
that would be a
with
collaboration
Centera
with like
or
Centera,
VCU.
VCU, yeah.
I thought the health department did.
I was gonna say, a lot of like health department places, I know Lunenburg County, I know that's not our
Yeah, the VDH should be
places
doing
do that.
But yeah, or VDH doing, cause Centera has a mobile unit. And if you did Revive, and I guess you're suggesting the Revive type training.
Right, with Lock and Talk as
with
well
the
as.
testing, and yeah.
No, that's a great idea. I mean, the more.
So I know she's out of Henry County, but if you message Ariel Johnson, that's who is over it in Henry County. So
Do you have an email for that?
I can find one and I can send it to someone if they email me.
Awesome. All right, so I put the flyers up for everybody. Let's see, where's the other one? That one, this
So
one.
Kenan, can you talk a little bit about what's different about the older, like, cause I went through the one dayer. That was for, I think, just people in general. What would be the difference with the older folks as it pertains to older folks?
It talks about, it's gonna specifically, like what's different from the youth and the adult. With the older adult, we're gonna spend time talking about the characteristics, life circumstances for older adults, what typically the life experiences they go through, like loss of a spouse, chronic illnesses. They're gonna talk about, common symptoms of that, signs and symptoms of someone struggling with a chronic health condition, the idea that you could then connect them to someone to talk to, saying, you know, this is important, you're having now this ongoing health concern. Be good to talk to someone professional level to talk through those feelings. And it's the same type of information, action plan, suicide ideations. The case studies are gonna focus on 3 different older adults.
Gotcha.
All again, going through a different life circumstance. The videos, because it's an all in-person class, it doesn't have as many videos. It doesn't do the panic attack video. It does do, I'm blanking on his name, but you know, the young guy has his father whose mother has passed. The name escapes me, and I've only done it
I can see
4,000
his
times.
face.
But anyway,
Yeah.
I wanna say Peter, but it's not Peter. It's the young man whose mother has passed and he's worried about his father.
Yeah.
That becomes the central video series throughout the
Got it.
day, to use
Okay.
him as a more of
That
a
makes
deep
sense.
dive case study.
Yeah.
What,
But let me say this, if you've already had the adult mental health first aid, taking this would be good, but it's also gonna be some repetitive.
But it's a good refresher.
It would be a great refresher.
Right.
Older
it's gonna be-
adults are very high, have a very high suicide rate, which is
Right.
why it's a different demographic.
Yes,
Yeah, no,
Yeah.
that totally makes sense to me, because they're dealing
Right.
with a lot of
a
different.
lot of life
issues.
circumstances.
They're not
that-
dealing with, oh, my career's falling apart around me.
Right,
They're
right.
not,
Dealing
you
with
know,
end of
whatever,
life
yeah.
issues and yeah.
Right,
so-
right.
So what age are you, sorry, I'm asking, what do you consider an older adult?
Oh, well, we don't, in the training, it just says older adult, so. I'm suggesting that would be between 65, and probably because I'm close to 60, I'm like, oh, it's 65. Sure.
That's it, I'm over 70,
Yes.
so I'm trying to figure this out now.
Given my recent limp, I'm probably gonna put myself in there, to be honest with you, as I've been told
Most of the time you
recently.
think 60 or older.
Yeah, in
Yes.
Virginia, it is 60 or older, cause I have had clients, I've
Yes.
checked the elderly bots and they get really upset.
Yeah, once you hit 60, you're good to go.
Would you like me to try to get a hold of some of my
Absolutely,
to
absolutely.
come, or is this
Yeah,
for the
no,
trainers?
No, this is open to the
Sure,
community, we're
I know,
hoping to max
I
it
got
at
you, I'm just,
25.
that's why I asked,
Yeah,
how many old folks do you want?
Lots.
right. Well, you don't have to be an old
Yeah.
folk to be in the class.
No, you can, no.
Right, this is anyone who likes, if you have family members that are older, if you're older yourself, wanna know about your peers, or you could also work. You work with older folks.
Because you're right, because all of us are, even our parents are all getting older.
Right.
And so it.
Yeah, you just have to be 18 to be in the class.
Yeah,
You don't have to be older
I
to
got
be in the
that covered.
class. And I'll say this, the effort to go ahead and make this class part of our offerings, which takes a few months given our small staff, was because of the number of requests we had gotten from folks who work in the community with older folks. So I thought was really heartened by that, to say, well, if there's a need where folks are providing services or support, caregiver support to older adults and have experienced a loss due to suicide, that this was something that we then made application for about 4 or 5 months ago. And then it finally came through, and we are launching, because once you get certified in something, you gotta launch it within so many days. And so it's gonna be the end of August. And of course, we're hoping to fill it, because again, we'd like to host it again. And then
Yes,
Jen and
sure.
I'll, be here. And then Jen and I are already actively working on when the next set of classes will be. So in the fall, we'll be offering the adult, we'll be offering the youth, and we'll be offering the older adult. And I don't know, I'll be honest with you right now, I don't know why, but we end up having to shut down all the youth classes we had focused on last year. All the adult classes, except for one, filled to capacity. So we're gonna try again, reaching out to the YMCA and a couple other partners. We're hoping this fall, towards November, December, to have some more folks take our youth mental health first aid class, because that,
And you know what, we got a new mental role model
Yep.
okay,
program coordinator.
Kadisha McCargo.
Yeah, I would suggest at least Halifax way, but I know she's trying to get towards Mecklenburg. And that, so she may have some inroads there with at least
Okay.
some parents and some kids.
good.
Because, it's the whole
Okay.
family approach where we
Yeah,
work.
and the
so.
class, you have to be 18 to be in the class, but the class is about supporting those who are struggling,
Well, and
that
then
are
for their parents.
basically
Yeah.
13 to 20 or so.
Parents, grandparents. whatever.
Right. Right. And we're trying to do better at that, because last year we ended up shutting all 3 of those classes down. And it may have been due to weather, it may have been just due to the amount of time that we had for the outreach, but we hate to shut any type of class down.
People working.
Yeah, right, and busy too, busy with, those who serve youth, as you all were talking about, already short-staffed, already pushed to the wall about what they can do for budgets, so, yeah. We didn't take it personally, we just felt like the outreach must have been off, maybe try to capture an audience that's already coming to the class and then opening it up to the community.
Thank you, Amber. I see that email.
I think for the older adults, reaching out to, local pastors might be a good idea too.
Okay, and that's all my announcements. We forgot, almost forgot.
TARP updates?
Well, before that, National Night Out. Jenna is already reaching out to coalition membership.
Yes.
Sent them an email that we are participating in National Night Out, as we've done for the last 8 years I've been here. We're setting up in the 4 locations, Halifax, Mecklenburg, in Chase City, Brunswick at Main Street, and then South Hill at Parker Park. And we've got teams, staff here, they're gonna be going out, but we definitely want coalition members, as always, to show up and support. And we got some really cool items that we created. We've got pencil pouches that have You Matter with the 988 number on for young people. We've got bright orange. You mentioned asking our young folks what they thought would be appealing.
Yes.
There you go.
Amber National Night Out.
Bags.
Amber National Night Out is on August the
This
5th.
is our extra.
Yes, and I don't have a flyer for that, unfortunately.
Oh, yeah.
August
How
5th.
are we like advertising this? Like, how are we getting this information out? Like, cause I didn't know about National Night Out, you guys been doing it for how long?
For years.
Decades.
I mean, I'm just being honest.
No, prior to, no, yeah, it wasn't just our
Well,
initiative.
National Night Out is.
Yeah, it's not a-
designed to the.
It's a national,
Yeah,
yeah,
it's
it's
a
a
national
national.
initiative.
Campaign, yeah.
Yes.
And it brings law
It's
enforcement.
the second Tuesday of every August. It's sponsored by law enforcement.
And
I mean, I
so,
never heard of it.
I know.
Yeah, we don't put it on, they put it on.
Yeah.
Or like the.
Law
we just
enforcement.
We just
Law
attend and we
yeah,
want
just
people,
attend.
we do need coalition people to come and help
Yes.
table though, just because we
Please,
have staff,
please.
please, we really need people.
We're,
Jenna, I deliberately didn't sign up, just tell me where you want me to go.
Perfect, can you come and chase it?
Yes.
Thank you so much. I'll see you there.
And I didn't sign up either. I don't mind doing Chase
I
City
just
either.
figured, cool, where you need me, that's where I'll go.
Cool.
yeah,
You don't have
I'm
to
the same
do
way
it
as the other
for-
two.
Oh, there you go, Jenny. You got 3 people coming to Chase City.
I don't need that many people.
Wait.
I don't know. I'm gonna put you somewhere.
Yeah, no, and that's what I would have done too, is go to both.
Yes.
Tri-County probably will be there and for the coalitions.
No, I was Tri-County, I just had a little setup next to the.
All right, so everybody online, we don't have a flyer for that yet, do we? No.
But there are flyers for Chase City and South Boston and stuff. I think they're on Facebook. or
Right,
something
right.
like that.
There- We have it on Facebook. We don't have a specific flyer, but I requested one. That's basically going to say that we are all going to be on August the 5th in National Night Out,
Right.
same 4 locations as last year. All right.
What is the time? I have a group of.
Oh, yeah,
7, but they
let's
come
see, in Halifax,
After, it's still needed.
I'm in Halifax, Fairgrounds, hold on a second.
It's usually from about 4 to 8 at 4 different locations.
Yeah. And Fairground, isn't it?
That's the
Fairgrounds
norm, yeah.
It's 5 to 8 PM, right?
If
Is
the
it-
setup is 4 usually. At least that's what Sarah said. I don't actually.
Yeah,
I
I
haven't
think
been
it was, I think it's
So-
4.
Brunswick. In Brunswick, it's 6 to 8, right? And Chase City, oops. My finger's doing today. Chase City,
They're taking after your foot.
I know, my age is showing, right?
Hey,
Chase City.
Kenan, are you
Yes.
able to share the contacts for those national nights out so we could also sign up for other booths?
Yes, we have that.
Yeah.
I can't do that at the moment, but Sarah has that.
Sarah
right?
has. I can get you in contact. with
Yeah,
Sarah.
yeah, we can do that. Yeah, we can do that. That was Amy, right?
Yeah,
Maybe,
it's you, Trent.
Amy, yeah, absolutely, Amy, we'll help you, and then, what's the other one I was thinking of? South Hill.
Yeah.
South Hill is also 5 to 8.
It was just county, and so it was all at Chase City for a while, and then South Hill separated.
In my 7 years here, I've never seen it advertised.
Yeah.
I've known it.
Wow, okay.
We've worked it before with other Leos, being in the military, but I've never heard a word for it here.
I see it on Facebook.
Well, each of the counties, I think, or each of the entities tend to advertise it themselves. And then we've in the past made a flyer just saying that Southside Behavioral Health and the Coalition were gonna be there. And I
Are
was
we
thinking,
gonna,
I think there really isn't a budget, like I don't have a budget to pay for ads behind National Night Out, and probably those organizations probably don't
There
either.
should be
You know what?
PSAs in the Sun and the Enterprise and everywhere else.
But you know,
So the way you get around that is that you can't advertise yourself, but you can do an interview talking about the event that you would really like people to come
But
to.
that's what I mean, PSAs.
Yeah, but my PSA for the veteran event, can I tell you when my free PSA came out in newspaper? That day.
Right.
Cause my mother texted me and said, oh, your free PSA articles in the Mecklenburg Sun. That day was when we read Summit.
Right, the one thing I can suggest is if you belong to the coalition and you're interested, I think it's Instagram, and we also
Yes,
have,
Facebook.
Facebook. I would recommend a committee of citizens that want to be the people who then spoof everything out to their networks, and, all the little tendrils go out. It's very effective. It's marketing 101 from social media people. Having yourself an internal team to do that work
Yeah, true.
is important, especially people who have diverse contacts.
Mhm.
Cause I don't know if you're on social media, but Dennis's social media probably looks nothing like mine.
Right,
About this much.
Right. But, if that's a possibility too, so I would say if you're gonna share it unpaid and not pay for it on social media, let us know that it's there so we can then go out and look for it
Okay,
if
right,
it
right,
doesn't
right,
pop up. Because quite honestly, I used to get a lot of Southside Wellness Coalition stuff pop up. I'm getting less and less, but I'm on social media less and less.
Right. And there's a lot more paid ads on social media than there ever been before. So
Right.
now, yeah, even myself, I don't see Southside Behavioral Health as much as I used to because the amount of paid ads.
Yeah.
That you're constantly trying to navigate around.
Right,
Yeah.
but if we do start a group internally that like a committee or whatever that does that, then the logarithms will pick that up and change things for us.
Yeah.
And so it'll get out to at least our contacts. And everybody is able to do things a little bit differently. If there may be people who are more than willing to help do that, but they can't get to a meeting.
Yeah.
Yeah.
Right.
Yes, National Night Out is always all on the same day for all locations. It'll still all be on August the 5th.
Yes. Thank you, yes. All right, and then TARP update, sorry about that.
I do not have any TARP updates. Christine is not on the line. Have you spoken with her recently, Kenan?
No, but I know that we talked, when was it that we talked about developing the work group, but I guess that's something we could talk about.
Right,
maybe next.
and that's a great point, Kenan. Leadership is meeting this coming Monday.
Mhm.
Right.
And we are going to be discussing the idea of going back towards working groups
Mhm.
and seeing who in leadership wants to lead a working group and who wants to participate in that working group, so that we can, take less time to get more done, basically, and see if that's a model we want to utilize. We utilized that several, maybe 4 or 5 years ago before COVID, and possibly thinking about going back to that. But we have to discuss it as a team. There's nothing set in stone. So if you have any feedback, get to a leadership member, or Kenan or Jenna before we meet on Monday with any ideas you have.
Yeah, and I plan on running copies of all the previous work group documents that we
Right.
created, was it during COVID?
Yeah, right at the tail. It started, I think, prior to
Yeah,
COVID.
right around
Yeah.
Ann Bishop.
Yep.
And talked about all the different work groups. I'll bring copies of all that so that folks can see if we want to adopt some of the same language. Just so we're not reinventing, well, we're reinventing the wheel, but I mean, we're not starting from scratch.
But we know it's rent.
Yeah. So I'll have all that ready for Monday night.
Right, and I know Brian was on a committee with me.
Yes.
We were on the bylaws committee. That's already been done. I don't necessarily think we need to have that
No.
committee again.
Please, we don't need to do that again.
But how do we want to structure it, given that we're now going with this new logic model and this, we just need to,
Right,
it needs to be
yeah.
a discussion, so we're prepared for that, and hopefully you all can provide some insight for us.
Okay, all right, and now we'll turn it over to any other additional member updates.
So I do have some COC updates and I'll
Okay.
write these down for you so you don't have to say notes.
Okay, cool, thank you.
So the last meeting was on June the 26th, so it was a few hours after our last meeting. The COC was initially awarded $126,844 for all of our programs except UPSH. So that's for emergency shelter, homeless prevention, rapid rehousing, HMIS, that's our online data system, and then the COC planning. A few days after the meeting, on June the 30th, we were informed that the funds would be decreased by $25,000. So our budget is now $101,844. This is nearly a 20% cut and will directly affect the amount of people we are able to assist this year. This applies to all COCs, and these funds are being reallocated under a separate grant for capacity building only. We have not been told what capacity building should look like.
Yeah,
We're
whether
still
that's
waiting to hear.
training, whether
Yep.
that's.
We're still waiting to hear. We also did get the finalized numbers from the PIT count. PIT is, point in time count. That's the count that we do nationwide every January to, count how many homeless people are in the area. It is extremely flawed for a rural area. It's intended for people to go out and meet people to see if they're homeless. That's not what rural homelessness looks like, if you were here from our presentation last month.
Yes.
But, we did find in Southside, so this also includes Charlotte County, 22 households and 34 individuals were counted during this year's point in time count. 9 were under 18, 2 were over 65. 13 of those households and 16 of those individuals were unsheltered.
It's 2 over 65?
But that's like I said, this
Yeah,
is
because
extremely flawed.
I've seen,
I did Charlotte County this year, and so I went and sat at Sheldon's for 4 hours and waited for homeless people to appear. None did, because it's not a good way of tracking if
That's
someone
right.
is homeless.
Yeah.
13 households and 16 individuals were unsheltered. That means that they were sleeping in a place not meant for human habitation at that time. Some of the others were sheltered. That means that they were in a homeless shelter, in our domestic violence shelter. We had put them in a hotel already, but they're still considered homeless. So we did not count as many people as we did last year. That being said, there are just as many, if not more, homeless people in our area as there was last year. Our next meeting will be August the 21st, and I will let y'all know if we find out what capacity building means. And I'll give this to Jenna.
All right, next member update.
Hey Kenan, this is Allison. I just wanted to kind of put a bug in everybody's ear, and I sent out an email, and I'm sure I'll be sending out more. September is coming up, and that is Suicide Prevention Month. So the VA, every year we have a suicide prevention resource fair. This year it's going to be on September 30th from 11 to 2. And so we just welcome any community partners that are interested in coming and being able to tell veterans, their family members, et cetera, about the services available. Feel free to email me, and I'll put my email in the chat too if you're interested in reserving a table. But it's a good opportunity to kind of spread the word about different mental health, suicide prevention resources, and just general resources. So would love to see some of y'all there if you can make it.
And where's that at?
It's going to be at the VA hospital in Richmond, so it's a little bit of a hike. But I can, I have a flyer I can put in the chat. It has the address and everything too.
Thanks.
No problem.
So, our mentor role model program at Tri-County is hosting their open house today from 1 to 6. Several community partners will be there, including behavioral health, some Cara. We're, like Catherine said earlier, we're really trying to get our mentor role model program back off the ground. So if any of you are able to attend or send somebody our way, we'd love to see them in South Boston.
We're looking for both mentors and mentees, if anybody is so inclined, and they range anywhere from kindergarten to a high schooler. And,
Is there a flyer?
oops. I have a hard copy one.
I don't have I have it on Facebook.
Oops. All right, anybody else? Floor is open. Anyone else? All right, future meetings, the next meeting will be August 21st, 10 a.m., same time, same place. The meeting link will be it was in the minutes, it will also be in the next agenda. And reminders about Facebook, Instagram, our website. Any last comments before we adjourn?
Did you send this article?
Absolutely. It's also gonna be in our next newsletter too.
Okay, all right. If it's in the next newsletter, that's good enough for me.
Okay, I'll call for the adjournment at 11:31.
Thank you, everybody.
Yes, thank you, thank you, thank you.
Jenna, I emailed them to me.
All right, please keep your eyes peeled for our monthly newsletter, which came out Tuesday morning of this week. And next month.
This is in there, or is this gonna be in next month?
That's a really great question. I didn't see it this past, so it's in next month.
Okay, all right.
I have so many days prior to the newsletter to get everything to Ellen. All right, let me stop the recording.